With the wide usage of HA fillers in the aesthetic industry, we as injectors have encountered an array of complications and side effects pertaining not only to the injection techniques but also to the product used. So as a doctor, it becomes an important judgment on your part to choose the product carefully. HA fillers can cause adverse reactions like granulomas, lumps, or unevenness. And since they have an extended time in vivo, it becomes an important aspect to understand their tissue reactions and their long-term behavior, because this can potentially lead to immune attacks. In this video, I'll be taking you through a few points which are important to consider when choosing a safe and effective filler for your patient. Now, we've always understood rheology as an important characteristic of a filler, but there have been studies like this one, which have been published in the Journal of Dermatologic Surgery, where the authors have compared HA and non-HA fillers, and they have demonstrated that rheology is not the only criteria to choose an HA filler. The results of this study also indicated that biological interactions are very important in the filler performance. Now, how a filler performs in vivo is heavily dependent on its tissue integration, and this leads to its resistance to deformation over time, and that is leading to more efficacy in the longer run. Hence, it is important to choose the filler based on all the parameters. Let's start with how the manufacturing of the HA gel takes place. Now, HA before cross-linking is a very low viscosity, low elasticity product. It is the cross-linking with BDDE that gives this HA a gel-like consistency. BDDE is a chemical cross-linking agent which binds the HA chains together. We must understand that BDDE is essential for the cross-linking and is the safest cross-linker available. However, excessive BDDE or too much modification of the HA can lead to side effects. There have been various studies which have demonstrated the side effects of high amounts of BDDE. Many of these linker molecules, which may be released during the degradation of the cross-linked HA gel in vivo, can be irritative and toxic to the surrounding tissues. Also, the high amount of degree of modification of the cross-linked HA gel can alter its biocompatibility with the tissues. These chemical bridges introduce additional chemicals to the natural HA, which can again lead to immune attacks or granuloma formation within the tissues. Here, I would like to introduce the EPTQ fillers, which score very high on the safety profile because the EPTQ fillers have the lowest BDDE percentages and the lowest degree of modifications among the fillers currently available. EPTQ uses cross-linking with 2CM technology, which involves chemical cross-linking with BDDE, as is widely used. But what distinguishes the EPTQ fillers is the physical cross-linking. This physical cross-linking happens at optimum conditions of pH, temperature, and ionic strength conditions. This chemical and physical cross-linking together leads to more duration of efficacy when we are comparing it to the competing brands. With these properties of the lowest BDDE, lowest degree of modification, and the manufacturing process with 2CM technology, we are definitely looking at lesser delayed hypersensitivity. The 9 process followed by the manufacturer involves the usage of EP and USP registered HA raw material, minimized residual BDDE, and low endotoxin level as low as 0.1 EU per ml. All of this actually contributes to the reduced side effects after the procedure. This underlines the core value of the EPTQ filler, which is utmost safety for usage. Now let us talk about other important points when choosing a filler: the extrusion force, cohesiveness, and viscosity. So here we must understand how a monophasic or a biphasic filler is formed. When the chemical cross-linking of the HA has happened with BDDE, we can manufacture it in the biphasic way or the monophasic way. To this chemically cross-linked HA gel, if free HA is added, this leads to a biphasic filler. But when it is ground without the addition of free HA, it leads to a monophasic filler. And EPTQ is a monophasic filler. The monophasic filler is more cross-linked, highly cohesive. At the same time, it is more homogeneous. And when I talk from an injector's perspective, it is a great attribute to have when we are talking about injection into the nasolabial folds or cheeks or even the forehead. Talking about extrusion force, the biphasic filler, obviously being more stiff, will need a thicker bore needle to flow evenly through, whereas when we talk about monophasic fillers like EPTQ, they can flow evenly even through a narrow bore needle, making the injecting experience more predictable and uniform. Even for an injector who is a beginner, the injection of a monophasic filler leads to more predictability. The extrusion force of the EPTQ filler is optimal, giving an ease to the injector as well as to the patient. When we're talking about volume replacement, moldability and high cohesiveness are again the two most important attributes that we as injectors are looking at. And again, the EPTQ fillers score very high on these two attributes. This high cohesiveness of the EPTQ fillers leads to optimum lifting capacity without migration. I would like to mention this clinical study which demonstrated the high cohesiveness and gel integrity of the EPTQ fillers. They had excellent profile for forehead contouring with sufficient G' and high cohesiveness, which actually withstood the pressures from the frontalis muscles during the dynamic facial expressions. The range of fillers offered by EPTQ is really diverse, from fillers which are robust and give higher projection on the high points of the OG curve or the chin and jawline, to fillers which are softer and can be used for volume contouring or used in the tear trough areas, lips and the forehead areas. It satisfies me as an injector because their range is really suiting every need that the injector may have. To conclude, we must keep all these safety parameters in mind when we are choosing a filler for our patients. Here I would like to highlight that EPTQ fillers tick most of the boxes on my checklist when I'm making my choice of product. I hope this video will help you in opting and deciding for the right filler for your patients.